This is Lab 4 structures of the skull. First structure on our list is the frontal bone. All of this is frontal bone. Frontal sinus, well, you can't see it on this model, but it would be behind here. So we'll use our sinus models that I mentioned in lab about that. This is your supraorbital foramen, the supraorbital nerve, and the supraorbital artery go through there. The nerve is a branch of cranial nerve 5. We have our parietal bones. There's 2 of those. You see a sagittal suture. This is your coronal suture. Now your temporal bone. This is your temporal bone. This is your squamosal suture. External auditory meatus. We have styloid process. This is your stylomastoid foramen. Facial nerve or cranial nerve 7 goes through there. This is your mastoid process. This is the zygomatic process of the temporal bone. From this view, you have a carotid canal. Internal carotid artery goes through there. This is your jugular foramen, the internal jugular vein, your glossopharyngeal, your vagus, and your accessory cranial nerves go through there. Internal acoustic meatus is right here. The vestibular cochlear nerve and the facial nerve go through there. Also the internal acoustic artery. Now onto the occipital bone. We have your lambdoidal suture. This is your lambdoidal suture. Foramen magnum. The medulla oblongata, accessory nerve, and the vertebral arteries go through there. These smooth parts are your occipital condyles. On the back, you have your external occipital protuberance. Along with this point down here is your inuan process. Nuchal lines. And you have a hypoglossal canal. It's kind of hard to see from this angle, but I just stuck this pointer through it. Hypoglossal canal. Your hypoglossal nerve goes through there, cranial nerve 12. Onto the sphenoid bone. We have a sphenoid sinus. We're going to look at our sinus model for that. This is your sella turcica, or Turkish saddle, or another name for it is hypophyseal fossa. So there's 3 names for that feature. Greater and lesser wings. These are your lesser wings. These are your greater wings of the sphenoid bone. Flip it over. We have our pterygoid plates, lateral pterygoid plates, medial pterygoid plates, optic canal. This is your optic canal. Your optic nerve goes through there, and your ophthalmic artery. This is your superior orbital fissure. Your oculomotor, trochlear, trigeminal, and abducent cranial nerves go through there. Your inferior orbital fissure, trigeminal nerve goes through there. Going to the base, you have your foramen ovale. Foramen ovale, that's cranial nerve 5, your trigeminal. Foramen lacerum, that's your internal carotid artery and your auditory tube, pass through there. Foramen spinosum, that small one right there. Your meningeal blood vessels go through there, foramen spinosum. And your foramen rotundum, that's your foramen rotundum. The maxillary nerve, trigeminal, you could say, cranial nerve 5. go through that foramen rotundum. Onto the ethmoid bone. Ethmoid sinus, we're going to look at our sinus model for that. You have your cribriform plate. They used to call that the horizontal palate, or maybe they still do, I don't know. Within that cribriform plate, you have little holes. Those are your olfactory foramina. Olfactory nerves enter. We have your ridge line here. This is your crista galli. Now we're going to look in the nasal septum. For our purposes, the upper portion of the septum that divides your nasal cavity into a left and a right side. The upper portion we're going to say is the perpendicular plate of the ethmoid bone. Your superior and your middle nasal conchi, or concha, they are also features of the ethmoid bone. And that nasal septum, we mentioned already that the perpendicular plate of the ethmoid forms the upper portion of the septum.